Welcome back to the Science of Ageless Living. I'm your host, Dr. Ethan Hausman-Marquis. I want to start today with a puzzle. Imagine a drug that's been around since before the moon landing. It's approved in nearly 50 countries. It's been through hundreds of clinical trials. Doctors in Europe and Asia have prescribed it to millions of people for strokes, brain injuries, and dementia. It has a devoted following in longevity circles, and you can buy it online in about 90 seconds. Now here's the puzzle. After all of that, 6 decades, all those trials, all those patients, the honest scientific answer to does it actually work is still, more or less, we're not sure. That drug is called Cerebrolysin, and the story of why something can be that old, that widely used, and still that uncertain is one of the most useful case studies I know of. Not just about one compound, but about how to think clearly whenever someone tries to sell you the next miracle for your brain. So today we're going to do the full, honest walkthrough, where it came from, what it actually is, and it is not what most of the internet tells you it is, what it might do, what the evidence really shows, and where the science quietly ends and the marketing takes over. By the end, you'll understand this compound better than most of the people selling it. Let's dive in. Segment 1, the origin story. To understand cerebrolysin, you have to go back to mid-century Austria. The compound was developed by an Austrian researcher, and its developmental code name, the kind of clinical shorthand these things get before they have a brand, was FPF1070. That detail matters for a small reason. Whenever you see a compound with a code name like that, it means it went through a formal pharmaceutical development process. This wasn't cooked up in someone's garage last year. It has a genuine pedigree stretching back more than half a century, and it's been manufactured and refined by a real pharmaceutical company that entire time. Over the following decades, cerebrolysin spread through the medical systems of continental Europe, the former Soviet bloc, and much of Asia. In those regions, it became, and remains, a fairly ordinary part of the neurologist's toolkit. If you have a stroke in certain countries, there's a reasonable chance a doctor will put you on a course of it. It's given as an injection or an intravenous drip, usually as a series over several days or weeks. So by the numbers, this is not a fringe substance. It's approved in something like 45 to 50 countries for conditions including ischemic stroke, traumatic brain injury, and various forms of dementia. Millions of doses have been administered. And I want you to sit with the tension in that because it runs through this whole episode. Wide use is not the same thing as strong evidence. A treatment can become deeply embedded in medical practice, prescribed for decades, trusted by clinicians, familiar to patients, and still rest on a foundation that, when you examine it rigorously, turns out to be surprisingly shaky. Medicine is full of these. Cerebrolysin may well be one of them. Longevity and momentum are powerful forces, and they are not the same as proof. Hold on to that idea. We'll come back to it when we look at the trials. Segment 2, what cerebrolysin actually is. Now let's clear up the single biggest misconception about this compound, because almost every product page and hype video gets it subtly wrong. Cerebrolysin is not a single peptide. I know the marketing calls it a peptide, singular, like it's one precise molecular messenger with one clean job. It isn't, and that distinction changes how you should think about everything that follows. Here's how it's actually made. You start with purified brain tissue from pigs, porcine brain. Then you use enzymes to break that tissue down. This process is called enzymatic hydrolysis, and the simplest way to picture it is a paper shredder. You take large, complex brain proteins and you chop them into thousands of small fragments. What you end up with is a mixture, a standardized soup. Roughly 85% of it is free amino acids, the individual building blocks of protein. The remaining 15% or so is a collection of low molecular weight peptides, short chains, all of them under 10 kilodaltons in size. Kilodaltons is just a unit of molecular weight. The number to remember is that these are small fragments. So the honest one-sentence description of cerebrolysin is this: a standardized cocktail of amino acids and small peptide fragments derived from pig brain, some of which resemble pieces of the brain's own signaling molecules. Why does the "it's a mixture, not a single molecule" point matter so much? 2 reasons. First, it makes the compound genuinely hard to study. When you test a single, pure drug, you know exactly what you gave someone. When you test a complex biological mixture, batch-to-batch variation, and the sheer number of ingredients make it much harder to pin down what's responsible for any effect you see, good or bad. Second, it means you should be suspicious of anyone describing a crisp, elegant single mechanism for how it works. A soup of dozens of fragments doesn't have one mechanism. It has a haze of possible interactions, most of which have never been individually characterized in a living human brain. When someone hands you a clean, confident story about a messy biological mixture, that clean story is usually where the marketing has quietly taken over from the science. Segment 3, the one genuinely clever part, crossing the border. All right, I've been cautious so far, so let me give cerebrolysin its due, because there is one genuinely interesting idea at its core. Your brain is protected by something called the blood-brain barrier. Think of it as a very strict border checkpoint. Your bloodstream carries all sorts of molecules, and the brain, being the most precious and delicate organ you have, does not let most of them through. The barrier is a tightly sealed lining of cells that keeps large or potentially dangerous molecules out, while carefully letting in the specific things neurons need. This barrier creates a real problem for anyone trying to help an injured or aging brain. Many of the body's own repair signals, the growth factors that keep neurons alive, are relatively large molecules. And because they're large, they largely can't cross the barrier on their own. You could have a molecule that would do wonderful things for a damaged neuron, and it would be stuck at the checkpoint, unable to get in. This is where cerebrolysin's design becomes clever. Remember, it's a mixture of small fragments, all under that 10 kilodalton ceiling, small enough that at least some of them can, in principle, slip across the blood-brain barrier and actually reach the neurons on the other side. So the pitch is, instead of a large growth factor that can't get in, you deliver a collection of small fragments that can get in, and that mimic what those growth factors would have done. That's a legitimately interesting piece of pharmacological reasoning, but, and you knew a but was coming, being able to cross the barrier is only step one. Getting into the brain doesn't guarantee that a fragment does anything useful once it's there, or that the amount that crosses is enough to matter, or that the effect is beneficial rather than neutral or harmful. Can reach the target is a necessary condition for a brain drug. It is nowhere near a sufficient one. Keep that distinction sharp. Segment 4, a primer on the things it's trying to imitate. To understand what cerebrolysin is reaching for, we need to spend a few minutes on the real stars of brain maintenance, the neurotrophic factors. This is the actual, well-established biology, and it's genuinely beautiful, so let's give it room. Neurotrophic just means nerve nourishing. These are the molecules your nervous system uses to keep its neurons alive, healthy, and connected. There are several, and cerebrolysin's fragments are thought to imitate a handful of the big ones. The most famous is BDNF, brain-derived neurotrophic factor. If neurons were plants, BDNF would be a combination of water, sunlight, and fertilizer. It supports the survival of existing neurons, encourages the growth of new connections between them, and plays a central role in learning and memory. When you learn something and it sticks, BDNF was part of what made the connection durable. Levels of BDNF are closely tied to mental sharpness, mood, and resilience. Then there's NGF, nerve growth factor. This was one of the first neurotrophic factors ever discovered, and it earned its discoverers a Nobel Prize. It's essential for the growth and maintenance of certain types of neurons, including some that are especially vulnerable in Alzheimer's disease. There's GDNF, glial cell line-derived neurotrophic factor, which is particularly important for the dopamine-producing neurons that degenerate in Parkinson's disease. And there's CNTF, ciliary neurotrophic factor, involved in the survival of various neurons and support cells. Here's the through line, and it's the honest, evidence-backed heart of this whole episode. These signaling systems tend to decline as we age, and that decline is part of why aging brains become more vulnerable. Neurons receive less nourishment, connections are harder to maintain and rebuild, and the brain's capacity to recover from insults diminishes. That part is real. That part is well established. So the idea behind cerebrolysin, support these signaling systems, especially when they're failing after a stroke or in dementia, is not crazy. It's aimed at a real and important target. The question is entirely whether this particular pig-brain mixture actually hits it in a way that helps a human being, and that's where we go next. Segment 5, the proposed mechanism and the valley of death. Let me lay out the mechanism the way the research literature proposes it, and I'm going to be very deliberate about my verbs, because the verbs are where the honesty lives. The peptide fragments in cerebrolysin are thought to mimic the activity of those neurotrophic factors, BDNF, NGF, GDNF, CNTF. In laboratory studies and animal experiments, the compound has been associated with several protective effects: reduced excitotoxicity, that's the damage that happens when overexcited neurons essentially burn themselves out after a stroke, as well as reduced oxidative stress, dampened inflammation, and less programmed cell death. The appealing part of the pitch is the breadth. Most drugs target one pathway. A messy mixture like this plausibly nudges several at once, which, the argument goes, is well suited to conditions like stroke or brain injury, where many things break simultaneously. Now here's the caveat that the sales copy never gives you, and it's the most important sentence in this segment. An effect in a dish or a mouse is a very, very long way from a reliable benefit in a person. There's a phrase researchers use for the gap between worked in the lab and works in patients. They call it the valley of death, because that's where the overwhelming majority of promising compounds go to die. The history of neuroscience is a graveyard of neuroprotective agents that looked absolutely spectacular in rodents and then did precisely nothing, or actively harmed people, in human trials. This isn't rare, it's the norm. The rodent brain and the human brain, the controlled injury in a lab, and the chaotic injury in a real person are just different enough that most things that should work don't. So when you hear it reduces neuronal damage and boosts repair, always ask the follow-up. In what? In a cell culture? In a mouse? Or in a large rigorous trial of actual human patients? Because those are wildly different levels of evidence, and the difference between them is the difference between a press release and a fact. Midpoint break. You're listening to The Science of Ageless Living. When we come back, the actual clinical evidence, condition by condition, and the uncomfortable question of who paid for most of those studies. Music ad beat. Segment 6, what the evidence actually shows. This is the segment I'd want a member of my own family to hear, so I'm going to slow down. Cerebrolysin has been studied in 4 main arenas: acute ischemic stroke, traumatic brain injury, Alzheimer's disease, and vascular dementia. On paper, that's an impressive résumé. Hundreds of trials across dozens of countries over several decades. But I told you at the top, quantity of evidence and quality of evidence are not the same thing. Let's take them one at a time. Ischemic stroke. This is the most studied use, and it's where we have the clearest verdict. A 2023 systematic review, the kind of study that pools together many trials and weighs them by quality, looked at cerebrolysin and similar brain-derived peptide mixtures in acute ischemic stroke. Its conclusion was blunt. The treatment likely provides no benefit for preventing death, and higher quality studies are needed to say anything more confident. And there was a second finding that rarely makes it into the marketing. It might be associated with a higher rate of serious adverse events requiring hospitalization. So for the single most studied use, the best current summary is probably doesn't save lives and might carry real risk. Traumatic brain injury and dementia. Here the picture is murkier rather than clearly negative. There are individual trials that report improvements in cognitive scores, in recovery measures, but they tend to be smaller. They use a patchwork of different outcome measures that makes them hard to compare, and the overall quality of the evidence is often rated as low. When the evidence is low quality, a scattering of positive results doesn't add up to a reliable conclusion. It adds up to, we don't really know yet. Now, the part that ties it all together, and this is the single most important thing to understand about the entire cerebrolysin evidence base, a substantial portion of the supportive research has been funded by the company that makes it. I want to be careful and fair here. Manufacturer funding does not automatically mean a study is wrong or dishonest. Companies fund research for legitimate reasons, and plenty of manufacturer-funded trials are perfectly sound. But there is a large, well-documented body of evidence across all of medicine showing that industry-funded trials are systematically more likely to report results favorable to the sponsor's product than independent trials of the same treatments. That's not a conspiracy theory. It's one of the most robust findings in the study of how medical research gets done. So when a compound's positive results lean heavily on studies paid for by its own manufacturer, you don't throw the results out, but you apply a heavy discount. You wait for independent replication. And for Cerebrolysin, that strong, independent, high-quality replication is exactly what's still thin. So let me give you the fair, whole picture summary, and I'll rate my confidence honestly. After 60 years and hundreds of trials, the independent, high-quality evidence that Cerebrolysin meaningfully helps human beings is weak. That's not the same as it's proven useless. Absence of strong evidence is not proof of no effect, but it is very far from the confident brain repair multi-tool story you'll find on the product pages. The truthful state of knowledge is unresolved, leaning unimpressive, with a safety question mark attached. Segment 7, the regulatory reality and the vials online. Now let's talk about the thing that made you look this compound up in the first place, and the part that genuinely worries me, the fact that you can buy it online. Start with the regulatory reality. Cerebrolysin is not approved by the FDA for any medical use in the United States. Not for stroke, not for dementia, not for cognitive enhancement, not for anything. In the countries where it is approved, it's a prescription drug, meaning it's meant to be administered under a doctor's supervision with a real diagnosis behind it. So how are people in the US buying it? Here's the mechanism, and it's worth understanding clearly. The vials sold online are almost always labeled for research use only, not for human consumption. That label is not a quirk. It's a legal workaround. It allows a seller to ship an unapproved injectable drug without going through any of the approval, purity, and safety oversight that a real medicine requires, because technically, they're selling it as a laboratory reagent, not as a treatment. Everyone involved understands the wink, but that wink has consequences. Here's what that research use only status actually means for you as a buyer. You have no reliable guarantee of what's in the vial, no guarantee of the concentration, the purity, or the sterility. No regulatory body is checking that batch. No pharmacist is verifying the dose. And this is the part I really want to land. This is an injectable. We are not talking about a capsule you swallow where your gut provides some margin for error. We're talking about a substance introduced directly into your body with a needle. The failure modes for a contaminated, mislabeled, or non-sterile injection are not "it doesn't work." They're infection, immune reactions, and worse. An unregulated injectable from an anonymous online seller is one of the higher risk things a person can do to themselves in the entire supplement and nootropic world. So here's my direct advice, as clearly as I can give it. If Cerebrolysin genuinely interests you, and there are legitimate reasons it might, especially if you or someone you love is recovering from a stroke or a brain injury, the responsible path is a licensed physician who can evaluate your actual situation, weigh this against real alternatives, and, where it's legal and appropriate, oversee it properly. The irresponsible path is a credit card, an anonymous website, and a needle. Please don't let a compelling product page or an enthusiastic forum post talk you across that line. Segment 8, Listener Questions. Let's do a quick round of questions you've sent in, because a few of them get at exactly the right tensions. If it's approved in 50 countries, doesn't that mean it works? No, and this is one of the most valuable lessons in all of medicine. Regulatory approval standards vary enormously between countries and across different eras. A drug approved decades ago in one regulatory environment may never have cleared the far more demanding bar that agencies like the FDA apply today. Wide international approval tells you a compound is established and has a safety record deemed acceptable somewhere. It does not tell you it's been proven effective by modern standards. Those are different claims. The studies show improvement, though. You even said so. Some do, yes. The question is never just, is there a positive study? For almost any treatment, you can find one. The question is, what does the whole body of evidence look like when you weigh the studies by quality and account for who funded them? For Cerebrolysin, the highest quality independent look at its most studied use came back unimpressed. A few positive studies inside a low-quality, sponsor-heavy evidence base is a yellow flag, not a green light. Are the amino acids at least good for me? It's from brain tissue, so isn't it nutritious? This one's a category error, and it's a common one. Yes, the mixture is mostly free amino acids, but you get amino acids abundantly and safely from ordinary dietary protein, digested through your gut the way your body is built to handle them. Injecting a pig brain-derived amino acid mixture past your digestive system into your bloodstream is not nutrition. It's a pharmacological intervention with a completely different risk profile. The source being biological doesn't make it gentle. Is there any scenario where you'd say it's reasonable? Sure, under the care of a qualified physician for a serious neurological condition, in a place where it's legally prescribed, with the patient fully informed that the evidence is mixed. That's a defensible medical decision made by professionals. Buying it online to biohack your focus is a different universe of risk to benefit, and that's the version I'm urging you away from. Segment 9, the ageless tie-in done honestly. I built this show around a promise that understanding your biology gives you real power over how you age. So let me deliver on that promise honestly, because there's a genuinely empowering takeaway hiding inside all this caution. Remember the real, well-established biology from earlier in the episode. Your brain depends on neurotrophic signaling, BDNF and its relatives, to stay resilient, and that signaling tends to decline with age and inactivity. That's the actual mechanism of a lot of age-related cognitive decline, and it's the mechanism Cerebrolysin is reaching for. Here's the good news the vial sellers would rather you didn't dwell on. The best evidenced ways to support that exact system are not in a vial, and most of them are free. Aerobic exercise is the standout. Regular cardiovascular exercise reliably raises BDNF. It's one of the most robust findings in the field. Moving your body is, quite literally, one of the most direct ways to fertilize your neurons. Then there's sleep. Deep, sufficient sleep is when much of the brain's maintenance and consolidation happens. There's continuous, demanding learning. Taking on genuinely hard, new skills keeps building and reinforcing neural connections throughout life. There's social connection, which independently protects the aging brain. And there's managing your cardiovascular risk factors, blood pressure, blood sugar, cholesterol. Because what's good for your heart's blood vessels is good for your brain's blood vessels too. None of that is as exciting as a peptide from a vial. It doesn't come with a certificate of analysis or a same-day shipping banner, but it has something Cerebrolysin doesn't: strong, independent, replicated evidence and a risk profile close to zero. If your actual goal is a resilient, sharp brain deep into old age, that's where the real leverage is. So where does that leave Cerebrolysin? Right where the honest evidence leaves it, a genuinely interesting compound with a real 6-decade history aimed at a real and important biological target, and with a real unresolved question mark hanging over whether it delivers. Worth watching as the science develops. Not worth self-experimenting on with an unregulated needle. That's not me being a killjoy. That's me refusing to sell you certainty that doesn't exist. Outro. If you want to go deeper, check the show notes. I've linked the actual systematic reviews, the real evidence, rather than the product pages, so you can read it yourself and reach your own conclusion. I'd genuinely rather you disagree with me after reading the studies than agree with me on my say-so. That's how this show is supposed to work. A reminder before we close, nothing in this episode is medical advice. Cerebrolysin is not FDA approved in the United States. It's a prescription product where it's legal, and the research use only material sold online is not a safe shortcut around that. If you're seriously considering it, that's a conversation to have with a licensed physician, not with a podcast and not with a checkout page. Stay curious, stay skeptical, and take good care of the remarkable organ that's been listening to me this whole time. I'm Dr. Ethan Hausman Marquis, and this has been The Science of Ageless Living. See you next time.